Driving while under the influence of drugs, penalties for impaired driving, Part 1. Most people associate the word drug with illicit substances like heroin, cocaine, or marijuana. In actuality, drugs fall under a far wider group of compounds. The legality of a substance and whether it has any recognized medical usefulness have a significant impact on how we as a culture view drugs. Most people would turn away in horror if someone gave them heroin or methamphetamine, but they wouldn't hesitate to take a few aspirin to get rid of a headache. The term drug has the following technical definition: equals a medication or other chemical that, when consumed or eaten in any other way, has a physiological effect on the body. Alcohol meets this definition of a drug. Aspirin, cold medicines, coffee, and even cough syrup are all prescription drugs. Granted, the majority of illegal narcotics have a much higher risk of harm than over-the-counter pain relievers. But when ingested, all medications cause a chemical reaction that momentarily changes how your body functions. Because of this, any substance has the potential to be harmful and have an impact on your ability to drive. Many medications have therapeutic advantages that can raise a person's quality of life while relieving pain, bad health, or chronic disease. If your doctor or another medical professional advises you to use certain prescription medications, you do not need to avoid them. However, as taking too much of any drug can be fatal, they must still be handled with care and respect. Never take any prescription medication unless it was given to you expressly, and when taking medication, always take it exactly as directed on the packet. There are 3 distinct dose thresholds for each drug. 1. The bare minimum. The time when a substance starts to work on the body. Any dosage below this point would have no impact. 2. A dose that works. The time when a medication has its greatest therapeutic effect. 3. The fatal dose. Doses equal to or more than this will be lethal. People who regularly use drugs, whether for therapeutic or recreational purposes, develop a tolerance to the drug over time. This implies that the dosage of the medication they need to take to reach effective dosage grows over time. The difference between an effective dose and a deadly dose will steadily close, raising the possibility of an unintentional overdose. You are undoubtedly well aware that drugs like cocaine, heroin, methamphetamine, prescription pharmaceuticals, and even over-the-counter medications can all cause overdoses. But these are not the only drugs you should be cautious about. Even the 2 most popular drugs, caffeine and nicotine, which are both entirely legal, can be fatal if consumed in sufficient quantities. Caffeine can be fatal at doses of up to 10 grams. Between 100 and 200 milligrams are included in an ordinary cup of coffee. To reach a deadly dose, a person would need to consume 50 to 100 cups of coffee in a very short period of time. However, many diet pills and other drugs have a lot higher caffeine content and a much higher risk of overdosing because it is simpler to take 10 tablets than it is to consume 50 cups of coffee. About 40 to 60 milligrams of nicotine is required for death. To get this dose, a person would need to smoke nearly 2 complete packs of cigarettes in quick succession. The bad news for chain smokers is that levels far lower than this are still toxic and have been demonstrated to cause a wide range of harmful physiological effects. Any drug usage done incorrectly or recklessly can result in unpleasant short-term side effects, long-term physical and mental sickness, permanent brain and body damage, or even death. You need to be aware of the effects of ingesting chemicals as a novice driver and a young adult. Some medications can only be obtained with a prescription, while others are available over the counter at almost any store in the nation. Drugs are also hidden in a lot of well-known consumer goods that promise to aid in weight loss, alertness, study effectiveness, skin clarity, or better sleep. Treat a product with extreme caution if it makes any claims about being able to change how your body normally functions. Keep in mind that safe does not always equate to legal. Illegal drug use. Drugs and prescription pharmaceuticals can be used sensibly. They are still not completely safe, but the danger of harm, disease, disability, and overdose is much reduced. Use of morphine and other opiate painkillers is safe when done so under the guidance of a medical practitioner. You might be given this kind of medication if you go to the emergency hospital with a broken arm or another excruciating wound. A pharmacist may recommend sedatives to a patient with sleep disorders. Anyone looking to treat the flu or a cold can purchase and consume aspirin or ibuprofen. It goes without saying that the fact that the drugs would be used is what makes these conditions qualify as responsible drug use. With a prescription and guidance from a healthcare provider, and are strictly following the instructions for use listed on the packaging. If used excessively frequently or in high doses, each of the medications listed in these instances has the potential to be exceedingly hazardous. Based on a patient's age, health, medical condition, and any current medications they are taking, doctors and pharmacists who have completed years of medical school are qualified to determine if and under what circumstances a drug is safe to use. Drugs that are available without a prescription nevertheless have rigorous dosage and frequency recommendations listed on the leaflet inside the packet. The main distinction is that since these medications are thought to be somewhat less hazardous, individuals are permitted to read the instructions and self-administer the medications. Driving while under the influence of drugs, penalties for impaired driving, Part 2. Using drugs while driving. In the United States, drug driving is becoming a bigger issue. Federal and state law enforcement authorities find it difficult to address the issue of driving impairment since there are so many different legal and illicit substances that can do so. The drug that is most frequently discovered in toxicology results of drunk drivers, accident victims, and those involved in fatal crashes is marijuana. The list of compounds discovered in impaired drivers also prominently includes prescription drugs such as benzodiazepines, narcotic medicines, and amphetamines, like Ritalin. Drugs, unlike alcohol, have effects that vary so widely that it is nearly difficult to determine a complete legal limit at which people cannot drive while under the influence of a drug. Additionally, if a police officer stops a person on suspicion of DWI, a breathalyzer test may not be able to identify numerous intoxicating substances. As a result, when it comes to using legal drugs, it is up to the drivers to decide if they are fit to drive. Sadly, a lot of drivers aren't even aware that the drugs they're taking could make them less able to drive. Many prescription and over-the-counter drugs can impair one's ability to drive at quite modest amounts. Discuss the potential effects on your ability to drive with your doctor before taking any new drug or increasing the dosage of an existing one. You must also keep an eye on your own physical and mental health because some people are sensitive to specific medications and can experience side effects at far lower doses. Every other road user they come across on their route will be at risk of suffering a major injury or losing their life if that individual is driving while under the influence of drugs. The National Survey on Drug Use and Health, which was conducted in 2014, found that teenagers and young adults are most at risk for driving while under the influence of drugs. Statistics: 10.2 million adults, 12 and older, acknowledged engaging in drug driving at least once in the year before the study. The most common age range for young adults to drive while under the influence of drugs was found to be 18 to 25. 10% of people between the ages of 18 and 25 reported to using drugs at least once in the year before the survey. Teenagers and young adults are most likely to die or suffer major injuries in a drug-related collision, in addition to being the most likely to drive while impaired by drugs. Teenagers take risks naturally since they have little life experience. Additionally, they lack the advantages of having a wealth of driving experience to aid with risk identification and safe decision-making. The combination of substance impairment and these pre-existing disabilities is a prescription for tragedy and disaster. Prescription drugs. So who decides how and when it's okay to consume a drug legally? The Food and Drug Administration, FDA, and the Drug Enforcement Administration, DEA, are in charge of that, FDA. These two federal authorities rank chemicals under the Controlled Substances Act, which will be the subject of our next essay, based on a substance's potential for damage, whether it has medical applications, how likely it is to be abused, and its international status. A substance can only be used in certain ways if it is regulated by the law. 5 schedules make up the Controlled Substances Act. The most hazardous medications are listed under Schedule I. The danger and level of regulation of the pharmaceuticals decreases steadily as we move through Schedules 2 to V. A drug may be, depending on which schedule it belongs to. All usage save for scientific research are forbidden. Legal with a prescription for medical use, but automated refills are prohibited. With a prescription, it is legal for medicinal use, but it can only be renewed 5 times and for a period of time that cannot exceed 6 months following the initial prescription. Legal without a prescription for medical use. Most prescription and recreational medications are covered by the Controlled Substances Act. Unscheduled chemicals, or those that are not included in the Act, can nonetheless be quite dangerous. The 2 finest examples of this are undoubtedly alcohol and cigarettes, which, although killing thousands of people a year and having no known medicinal benefits, are nonetheless available for purchase and recreational use by any adult in the nation. Types of drugs and their consequences. The effects of various drug types on your body and mind are covered in Part 3 of this subject. Thousands of different medications, some of which are naturally occurring, derived from plants, are being employed for research, medical treatment, and recreational activities, made in a laboratory. Based on how they affect the central nervous system, the great majority of these drugs fall into one of 3 categories. Drugs that act as stimulants hasten the body's natural processes. Drugs that are depressants slow down the body's natural functions. The body's normal functions may be sped up or slowed down by hallucinogenic medications, which can also result in hallucinations. The specific effects of a stimulant, depressive, or hallucinogen vary depending on the substance in question as well as a wide range of additional circumstances, such as the user's physical and mental well-being, the user's mental condition, the medication's dosage. After the drug is taken, additional chemicals enter the user's bloodstream. All substances have the potential to result in short-term distress, long-term health difficulties, issues with mental health, and impaired driving. Drugs that might lead to physical or psychological dependence are especially risky because users may continue to use them despite harmful side effects and potential health risks.